Today on Behind the Strength, we're stepping into a conversation that goes far beyond medicine. We're joined by Dr. Karishma Kirti, a breast cancer surgeon who isn't just treating a disease, but helping women reclaim their bodies, their confidence, and their voice. Because behind every diagnosis, there's a story. Behind every scar, there's strength we don't always see. This is not just about cancer. This is about courage and the choices that can change or even save a life. Welcome to Behind the Strength, Dr. Karishma.
Thank you so much, Priya. It's a pleasure indeed.
You know, every person starts their journey with some trigger points, some reasons. Was there a reason behind you taking up your journey of being a doctor, and especially breast cancer surgery?
So I'll tell you this, all of this happened to me a little bit by chance and a little bit by choice. So I didn't intend to become a doctor. I wanted to do something completely different. Yeah. And for one reason or another, out of the three, I preferred medicine. I liked biology. So I got into medicine, but the day I stepped into medicine, I loved it. Even if the choice wasn't made by me, the choice was perfect for me. And the day I entered the cadaver lab, I knew I wanted to do surgery. I was confused between oncology and plastic surgery. So then I thought, okay, let me do oncology, and I joined Tata Memorial Hospital as an observer, and I joined the breast unit. Firstly, amazing, inspiring work and very, very good mentors there. Breast cancer and breast surgery is going sort of the sea change where a lot of plastic surgery is coming in. Right. So I happened to come into a field which joined two of my interests, oncology and plastic surgery, because we're doing so much reconstruction and it's evolving every day. So I found that very interesting for me. So it was not a personal trigger point for me, but just the interests happened to align.
How do you process the emotional weight of being an oncologist? It's not easy.
So, you know, when you are a trainee or in a system like Tata Memorial, you see patients once and then someone else might see them. So I often thought that what do people talk about when they talk about this emotional strength that you need? But after I moved into private practice, and then you see the same patients again and again, and you become their point person, a part of their family, you go to their kids' weddings and things like that. That is when you understand what that emotional baggage is. I think what I gain strength from, yes, of course, is having a family life and interests outside of, and not letting this consume me in a way. And medicine is like that. It tries to, you know, it takes up a lot of you, a lot of your time, a lot of your mental space as well. So consciously to make that effort. And the other thing that I draw comfort from is knowing that I have done, I won't say like the best there is, but my best for this patient. And if I had to go back, would I do things differently? If not, then, or even if, then that's the change for my next patient. So I think just a little bit of kindness towards yourself also, and
it works.
And always just giving your best for that patient in that situation. I mean, while not being completely scientific, because, you know, as a person, and that's why there's this concept of shared patient-doctor decision-making, is that you're talking about what my treatment goals are, what your treatment goals are, and coming to something together. And yes, you have to be objective about it, but it's not entirely possible to be completely objective when you're dealing with another human being with thoughts and feelings and family.
Do you carry patient stories home?
Not particularly. So I would say, for me, I think when you take work home, then you take kind of all aspects of it. Anyway, we have a lot of work encroaching because we do have patient calls and hospital calls and emergencies that we go for. So I think when I am present at home, I try to be as present as I can. But that is what works for me. And I carry patient stories to other patients, perhaps, which it is relevant for. Even I've had patients who talk to each, and patients do that a lot when they're waiting for their appointment, is you talk to each other. And I've seen a lot of patients draw a lot more inspiration and understand more from their fellow warriors rather than, you know, I could sit and counsel them for 2 hours, but that 10-minute conversation outside helps them understand it better.
Most certainly, of course. It's always the people in the same space who are going to resonate better with each other. About breast cancer, what truth about breast cancer is still ignored?
truth about breast cancer, which is often ignored, is people think that men can't get breast cancer. And while it's rare for men to get breast cancer, but because the awareness is so low in this space, generally also awareness about breast cancer is on the lower side. It is improving 100%, but men don't think they can get breast cancer because they don't think they have breasts, so they can't. So, but every 100 breast cancer cases that we diagnose, one of them will be a guy, and that guy will come 6 months or 1 year after having symptoms because they've never thought that this was a possibility.
It could happen to them. Why do women delay diagnosis, or as you said, even men delay it? But
so men delay it because of lack of awareness,
of course,
and often enough women do too, but women have a lot more going on. So there is a stigma of the word cancer,
right.
Then there is a certain shyness about talking about your breast because it's breast, it's so scary to say that
exactly.
word out loud. We're not having that conversation even within a family,
right.
I think those are the two, and sometimes just being able to prioritize themselves. Even now, patients who've been diagnosed, I have patients who say that, oh, it's my kid's exam, can I do my surgery 2 months later? And I was like, this is cancer, But there are moments when you need to prioritize yourself, and only once you prioritize and love yourself can you extend that to someone else.
Absolutely, absolutely. What's behind the mindset, of not wanting to react? Like there's something from the point of a woman saying that, no, let's not get into this zone, as you just said.
So, two things. One is that breast cancer lumps, more often than not, are painless. Right. So, the mindset of if it's not hurting, it's probably nothing. And the second thing is knowing deep down that it's probably something. And once it's diagnosed, then the whole thing. So the first thing that people think is that, they're going to remove my breast. Oh, I'm going to lose my hair. And I think those are the two big points that concern, I don't know, I don't deal with men so much, but women a lot.
Women, yes.
Is, of course, losing a part of your body, and whether you don't think or don't think, people often enough, they come in families and the decision makers are men, and they will say, oh, just remove the breast, like she's 60, what does she? And I'm like, that's not your choice, it's her choice and it's her body.
Absolutely.
If she has the option of conservation, then often enough I have to kick the man out and have this conversation one-on-one, saying what do you want if both the things are equally safe, right?
Right. And mostly, as you said, it's always the fear of, I feel, identity displacement post-diagnosis that kind of makes a person, I don't think overreact, more or less underreact to something like this.
Yeah, I understand. As I said, like deep down knowing that it's going to shift
my life,
entire life, dynamics, everything.
Absolutely, yes, I agree. What does holistic care, mean in real terms when it comes to cancer diagnosis?
I think we're so far behind that one aspect in India especially, is we're like, we've done the surgery, go take chemo. There is, cancer patients need it, there is no hand-holding through the treatment and post, and that is something that we need more support groups, we need patient navigators, and we really need more psychologists and counselors that help you process the information that you receive. And I don't think breast cancer care also stops when your treatment stops. It's not like this is your last day, so chemo, and you go home and you're done, because you carry it with you for a long time. When you come for your follow-ups, the anxiety of all of the scans and everything that comes after, and people says that, you'll go back to normal. You never go back to the normal that you were, but more so like a new normal that you create now. And so you need support from your doctors, you need it from your family, your friends, but you also need, if you have a community, a support group of other people who are going through the same thing. And that's really big in countries abroad, which is at a really nascent stage in India. And it's also a little difficult. I mean, we've been trying to sort of build this over the years, but patient advocates and patients who are survivors now coming back, I think we need more of that, and more from us also,
most certainly, but this would probably be in a strata of society that can afford this kind of care. Now, what about the strata that comes to hospitals where they can't really afford this kind of care?
Afford this kind of care and afford this kind of time. So for them, patients, because I work at Jaslok Hospital,
Right.
and I see a completely different set of people, and I work at DY Patil, which is a medical college hospital, and I see patients who are treated on a charitable basis and who are mostly
course.
on a government yojana and completely different. And every time they come to a hospital, they are daily wage workers. They lose a day. So for us to then tell them that, can you come back and speak to the patients who are having surgery? Now it's another day's wage
Exactly.
for them. So for them, having surgery, having their chemo radiation under one roof, and then even having rehab,
Right.
which is, shoulder mobility, having a prosthesis for your bra, which doesn't make you look flat on one
course.
side, even if you don't have a reconstruction. And those things become, more urgent. And then, you build upon that as and when you
Exactly.
can. As long as they're coming for follow-up. So,
It's
it depends on
difficult.
resources, it depends on what they're able to give, and it
Right.
changes, especially because in India we're not able to give, there is a care gap, whether we accept it or
Absolutely.
not.
There is.
I mean, there is a gap in that as well. But more so in all of this, getting the mental help that you need, the
Correct.
counseling that you need, the nutrition that you need.
The
all of that.
physiotherapy, everything that. Right. How important is mental health in recovery?
Mental health is very important, of course, in recovery, and it's neglected pretty often because you're, of course, dealing with so much. But also, I think women think that, oh, this is how it must be. So I think as doctors, it is kind of our duty. And for us, when we see patients on follow-up, to recognize the ones that need more help. And I think that it's very important, of course.
is.
And I think anything that we do now, especially with breast cancer, because survivorship is becoming truly important and quality of life is becoming
Right.
important, because our patients are doing well, which is great, and technology is improving, chemotherapy is improving, surgeries are taking more care to conserve more, to preserve self-image, self-confidence. So all of that, I think mental health is also a big component of that.
It is a big component also because doesn't the treatment by itself take a toll?
We know that you will have some cognitive decline, you will be more forgetful, be confused, oh, why did I do that? And that is a part that's known as chemo brain. We know there's a
Precisely.
cognitive decline with chemotherapy, where some chemotherapy which causes nerve damage and you will feel like pins and needles
Right.
or pain, and those side effects are known, but chemotherapy is not discriminating in the cells that it
Right.
kills, right? So you are
Precisely.
going to have some side effects in other cells that are, which is why there is an era of now targeted treatment, personalized care, which is really being researched upon a lot, and I hope
Right.
that will come into care more. And not only will it be more precision based in terms of treating only the cancer cells, but it will really bring the side effects down.
There are so many new treatments that are coming up on a daily basis. I read something which was cryo-based, but
Yeah. So we do have, in fact, a trial that came in, I think, 2 weeks ago. In India, we're a little bit far from that. We see more grade 3s, larger cancers, more aggressive subtypes. So whenever we talk about de-escalating, whether it is doing less surgery on the breast or in the armpit or not giving radiation.
Correct.
So if we have the one-off patient who is a lower grade, who is a very small tumor, who has only been detected because it was seen on a mammogram and the patient themselves didn't diagnose it, we can discuss these options that are sort of coming up, and we do, and that is the point of tumor boards and disease management groups. These patients are discussed, and collective decision is taken by the radiologist, the medical oncologist, the radiation oncologist, and all of us come together and give our opinion and come to a consensus. Because this
Absolutely.
is a little bit outside the realm
Right.
of hard evidence-based, what we call level 1 evidence.
Right.
And it's only applicable to a small subset, especially in our population.
absolutely. In fact, speaking about, things that are done outside our country, because of course Indian population is very different. All the countries have very different population from the the locations that we come from. But so I think there was also, I'm not sure if there was, I was reading about this, and I think, was it Switzerland who stopped mammograms?
So that's what. So it really gets snowballed into something else.
Yeah.
Well, it's not banned. So countries like Switzerland or Canada are taking stock and kind of discussing, do we need to do it? Because mammography is maybe gold standard, yes,
Right.
as an imaging for detecting breast cancer. But is it without any harms? There is an increase in overdiagnosis, overtreatment, because we know that some of the stuff we pick up, like DCIS, which is stage 0 breast cancer, in some patients is so low grade that it probably would have never presented as a cancer in that patient, because there are cadaveric studies in which autopsies have been done and breast tissue has been studied, and they found DCIS,
Right.
which never really presented itself. So yes, it has its positives. Yes, we do say that it, it catches some cancers, but it also treats and overdiagnoses. There is also some cancers which are interval cancers, which are the really aggressive cancers, which will show up between your mammogram in 2025 and 2026, and those are the more aggressive cancers.
But I think we're still at a nascent stage as a country to even have the kind of overdiagnosis.
Yeah. So
Statistic
a couple of
wise.
ways, yeah. So if you look at the Western countries, they have a breast cancer lifetime risk 1 in every 8 women. So 12% versus 4%. So our individual cancer risk is on the lower side. So it's hardly 1.5%. So our incidence and our prevalence of breast cancer in our country is on the lower side. I think that it's important to have your personal risk looked at by an
Right.
oncologist once you turn 30. So what are the risk factors for breast cancer? So there's some inherent risk factors, and that is if you have a family history of breast cancer, if you have a genetic mutation, then there's some hormonal factors. So these are some of the things that put you at a higher risk for developing breast cancer, but these are also something you can't do anything about. Also age and being born female, those also put you at a higher risk. Now what is modifiable? So being, your weight in the normal range.
Correct.
Especially when you're reaching menopause, and postmenopausal obesity is one of the major causes of breast cancer.
Right.
Then alcohol, even there is like lots of there's always in the news and the media where they say, oh, 1 glass of red wine is good for you. But
Absolutely.
so yes, alcohol, even very minimal amounts of alcohol contributes. Then taking oral contraceptives, and which is not a very large factor. And there's
contributor
also
to
like
it, yes.
you take it for 5 years or more, then it can cause
a compounding
increase in
effect.
risk. Yeah. So that hormone replacement therapy, these are some of the things that put you
Right.
at a higher risk. Having a child later, not breastfeeding or not being able to breastfeed. And then also I would say that also being in an urban setup. So when I look at a patient or when I look at myself, see, I live in Mumbai. I had my first baby after the age of 30. Weight wise, I would probably put myself in the normal range. So but that's what I tell. I have no particular family history, but if I say that if you have 2 risk factors or more, then probably you should get a mammogram,
yes.
and that would be appropriate for you. A lot of patients that we see also have health checkup based on their insurances, and those are a
course.
lot of mammograms that we see basically being done. Yeah, I don't particularly think that government needs to concentrate on this, but I definitely think that government shouldn't be concentrating on thermography, which is a lot of places have started screening for breast cancer using these thermography machines, and it's not an unpopular opinion. You ask any breast oncologist and you will hear the same thing from anywhere, is that it's not proven well. There are ongoing studies which are comparing it to mammogram, and that may give us answers, but till that comes out, we don't know. What I will tell you is self breast examination, and more importantly clinical breast examination,
Which is
has
the-
a role. So we've had studies from Mumbai which is done on our population, which tells you that there was 2 groups. One was just awareness and self breast examination,
Right.
and there was this other group that had a clinical breast examination every 2 years, and they found that in that group which had themselves examined by a healthcare provider, we were finding cancers that were earlier staged, that were being treated better, and mortality was coming down. So I think that would be something that doesn't even really cost that much money. You go
True.
have yourself examined by, and that's what I, when I meet my gynec colleagues, I say, all our patients, all women come to you. Those point physicians, the general physicians and the gynecologists, they can really truly drive that change, because a patient truly comes to me when they have a breast symptom. But who are these patients, the lay population that have no symptoms? They need awareness, they need screening.
I think promoted throughout all the stratas, and moreover, I think the women should come out, I think including myself, all women should take care of themselves first in this. Now, as you said, cancer patients are humans, you're talking to them, you're not going to be clinical about it.
We are clinical, of course, and that is the baseline, but we have to, it used to be, I would say, a very sort of, the doctor would say, do this, and you would do this. But nowadays, patients are more educated.
More aware.
Thankfully so, they are more aware, they are looking up, and I am very pro. You want to go ask AI, you want to go ask Google what this means and what that, go ahead, do it, but come back to me with your questions. Don't take that as blind faith. Precisely. Because machine learning can be very warped in some contexts. So I don't think that's now it is clinical. It's like, I know that if you have been diagnosed with breast cancer, you need to have surgery, and you need to have this thing, and you need to have that thing, and that is the information I will give you. But eventually a patient has to give consent, and it has to work with what their
psyche
idea is.
Exactly.
Unfortunately, we do have patients who completely refuse therapy that we know through lots and lots of research would be probably useful for them.
No, it's not about, I think from the opposite side, I always feel that a doctor is, meeting so many patients. There has to be a little gap. Because if you don't, then there's going to be a bias, and that bias is not really going to help the patient either. You can be objective, and of course you can have the compassion, but I think that's where the line has to be drawn, because otherwise it's not going to benefit the patient at the end of the day. That I, as the layman on the opposite end, I think every doctor is different. Every doctor's way of treatment is different.
Yes, I mean, that's also, like, doctors are also humans, and we, of course, everyone treats patients differently. Right. But I think everyone is clinical in a way that they know that this is appropriate, and then a patient has to just be given information.
Yes, from the patient, of course. What does quality of life after cancer mean to you?
Quality of life is based on so much, and I think whether it's physical health or mental health, and physical health, that an effect on mental health. Right. So when going back to when we spoke about how decision makers will just say, oh, just remove the breast, what does it matter? Why do you want to save the breast? And yes, but it's very much a part of a woman's identity. Right. Which is what I think there is a gap in that understanding, and there is lots of studies that will tell you that the way women view themselves when they have a breast preserved or reconstructed versus they have a flat chest is different. Yes. And there are patients in whom we ask and they don't regret it, but there are patients who wish they had been given that information, who've just had a mastectomy, but it has an effect on their self-image, it has an effect on their self-confidence, their body image issues, and sexual well-being, and all of these are very important. And I'm very cognizant of the fact that that our treatment changes you as a person physically and of course mentally as well. But we try to do as much damage control as we want, and I think from our patients what I would really like is for them to come and tell me everything that's affecting them. Right. Because a lot of time patients will think, oh, this is normal because I've had chemo, this is happening. Right. But I think that awareness that there is options for this, Correct. You are on hormonal therapy, you're having vaginal dryness, we can treat you for it. Don't just think that this is how it is going to be.
10%. But that's where holistic care comes in, where the oncologist also has to play a part role of a counselor.
100%.
How do women react to mastectomy versus reconstruction?
Mastectomy versus reconstruction, I think, is a very personal choice. So let me sort of little bit break it down. There's something known as breast conservation, in which you remove the lump and address the lymph nodes in whatever way, whether it's a biopsy or you do a dissection, and that is breast conservation. Now this can be clubbed with putting a flap there, which is, you can call it oncoplasty. Is you've done the cancer surgery and little bit of plastic, you can rotate a bit of a flap there or something similar, and that is breast conservation. Now mastectomy, post-mastectomy, you can have a flat chest or you can do a reconstruction, which is known as a whole breast reconstruction. So that goes hand in hand. So what are women's concerns, if that's what you're asking, is that one thing is, of course, when we do a reconstruction, there's a financial aspect to it, and it's very real, because a lot of patients in India are pay out of pocket, and there is almost a 3 times difference between just doing a mastectomy and doing a reconstruction, because while I do the mastectomy, there's another surgeon who's coming in, plastic surgeon. The number of days that you're in the hospital increases, and all of that. So it's a longer surgery, 2 hours versus 6 hours. It's of course a more morbid or a longer surgery. There, if you take it from the abdomen and reconstruct it, then there are 2 areas in which you've operated. But what is good is, especially if you take the patient's own tissue, is that the breast feel is very good, and over long term, and if you can save the skin envelope, the symmetry is very good in both the patients. So yes, during that time you have the 2 weeks or the 3 weeks that you need for recovery. You do spend more, but over the long term we have seen the quality of life is better.
Which is the actual end goal after cancer treatment?
It is, yes.
I mean,
so it's so multifaceted, right? We can say, that we want this and a recon, but there are patients who would really like to have a recon but can't really afford it, and so there are lots of options for that, actually, because we also are at PY, and we can do a lot of treatment which is covered in yojanas, especially if it's cosmetic for breast. So even insurance, if you do the reconstruction at the time of the cancer surgery, will cover it. But if 2 years later you decide that no, I want a reconstruction, they won't cover that. And I know people who are very happy with their flat chests also. So let's not take away from that.
It's like when I say quality of life, it's always subjective to that person.
Exactly.
It is never, quality of life might mean something to you, might mean something to me. As long as a person is happy at the end of the day, that is their quality of life, and they are healthy and they can function.
Whatever. So exactly. Yes. So everyone has a different mindset, and you counsel them and give them all the information that you can.
Right. Absolutely. Why did you take awareness to Instagram?
Awareness to Instagram, why not, is the question. It reaches so many. So, when very often we do a lot of camps and awareness talks in Sansthas, in buildings, mostly all of it will happen during October, because it's Breast Cancer Awareness Month. But this conversation needs to reach a lot more patient. 100,000 people come and listen to my awareness talk. No. Yes. So I think social media has really changed the game, and I think that awareness needs to reach a lot more people, and I think it does that. So a breast cancer cell divides into many cells, and that's how I think of it, that cancer cell grows and grows and grows without dying, and the information needs to do that same thing, maybe better, to really fight this fight.
Wow,
one person needs to tell 5 other people, those 5 people need to tell 5 other people, and that's how that information, when it spreads, it creates awareness. And that's all we need. We need women to come early, because really early diagnosis saves life. You know that you have a patient in stage 1 versus stage 4, and they are going to perform different. So of course, I think that is the one thing that I wish that I could change.
Any of the myths that you've corrected, other than men having breast cancer issues, any other myth with regards to cancer, breast cancer, that you've had to correct?
Loads. Oh, so many. I don't know where to stop. So one is that a lot of people think that breast cancer means having a mastectomy, and I talk about that a lot, that we can save the breast and still, treat you as effectively. The other thing is causes of breast cancer. People have the most strange ideas propagated by very good media also, saying that if you wear a black bra, you get cancer. If you wear bra at night, then lymph doesn't flow and you will get cancer. I mean, none of it is underwired bra. People think putting deodorant causes cancer.
I'm so sorry. Okay.
I was like,
Yeah,
you
the
just
few
smell
I've never
better,
heard of.
you'll have
One or
more
two maybe.
friends. Just put on your deodorant.
Please, yeah,
So
that's true.
so there's no scientific evidence that links any of these things. So, and I think there's also a lot of information
Right.
on social media and otherwise on the internet that gives you information that's not exactly precise. Whether you call it natural therapy or give it any other name,
Right.
it's misinformation.
Correct.
And I'm not saying it's a blanket for everybody, but we see it often enough.
Absolutely.
Because that works. Nobody wants to know that they need chemotherapy. You say it from a position of power, whether you're someone famous or if you have many followers, people will believe that because that's what they want to believe. I don't want to give you chemotherapy. If there was another option, I would give you that option. I know it's a toxin, I know that it has its side effects, but this is the thing that is proven and tried and tested by millions of women that tells you that this reduces your risk of recurrence.
Right.
So I think it's not just about screening awareness, risk factors, treatment options, but also about debunking the misinformation that is so rampant.
There was a time when I was doing my research for a personal situation, and someone, and I wouldn't, it was quite funny, but when you're down and out, you go to everybody and ask them for advice. Not the right people, obviously, because at that point of time, I was told about fenbendazole. There's a particular deworming medicine which is given to animals, and apparently the person cancer and been denied treatment, saying that you're not going to survived and is thriving today after taking just this particular medication which was given to him through some source again. And I was told that whoever's going into chemo should not go into chemo because that's going to kill them faster than the cancer.
Yeah. And we see that so much. Like, I'm not surprised to hear you say that because we see the fallout of that also.
I know.
That we have patients whom we diagnose who go and have whatever other therapy, alternative therapies, and then come back with disease which is worse. And then they're like, okay, now we're ready to take treatment.
Yes.
But what I will tell you is that there is a basis for evidence-based medicine.
Right.
And that is thousands of people, and there will be outliers.
Right.
If you happened upon one outlier, that's an anecdotal evidence.
Absolutely.
That does not compare to a level 1 evidence in which there were hundreds and thousands of people of multiple studies pooled together, so that we have eliminated as many biases as we possibly could, as much error or from results that we could. And that's when we give you based on something that I thought this, or it is written somewhere and it happened for that one patient. Can they also talk about the 10 patients who did not benefit from this, who stopped coming to them after 2 months? Allopathic medicine, which is so scary, is complete information based on scientific evidence, which we can give you because we have the scientific evidence for
Of course, and of course the experience also plays a very important role in that. Have you seen a miracle moment? Have you ever seen a miracle moment? Because there are times where, has there ever been any?
Yeah, but that is not one-off thing, but there are cancers that we know are more aggressive than other cancers. So when we treat those patients and they are higher stage and we think that we won't possibly tell them, we do tell them that there is a risk of recurrence, especially in this thing, but we do need to complete your treatment.
Of course.
So sometimes we still have those patients come back years and years after and be completely fine. I think those are the miracles, but not that one particular thing. I don't think I could possibly tell you, because we see very similar patients with very similar kind of disease don't do very well, and there will be some patients who do. And I think this is not my professional opinion, this is again anecdotal evidence from my side. I think a positive mindset really helps, and just being positive and manifesting, or I don't know what it is, but there are some very positive patients who take care of their health, and I think it works when you're thinking positively and being aware and being conscious of, is anything going wrong with me, and coming earlier. I think it plays into that as well.
What role does family play?
I think, when we talk about family plays, yes, an important role in terms of support, but I think we often forget that they are also going through this. I think it really affects the people around it. So I see that a lot, especially as we diagnose a lot of younger cancers, is just people, families trying to be very, very supportive, but also going through a lot of, like, it's hell for them too. So sometimes, whether the patient's being brave or getting counseling, sometimes I also ask, my counselor friend, that when they see the patient, can they also just turn around and have a brief word and see if the
That is
relative needs a little more
extremely important, because the
counseling.
caregiver is normally silent. So I understand that. And that is something we need much more of. That the counseling should be, I think, very holistic in that, and not towards just the patient or
Yeah.
around the family or whoever's kind of caregiving towards the patient. And that is something that, I'm hoping to see as the layman for a
Yeah.
lot of caregivers. What does strength mean to you, doctor?
I'm not saying not giving up, but not giving in, and just getting up, dusting off, and doing it again. And I see my patients do it all the time. They go through their chemo, they go through surgery, they go through complications of it, and they come back smiling with, hair regrowing, nails regrowing.
Living again.
That what makes you deal with the emotional burden is that you may
Yes.
have patients who are not doing that great, but then you also have patients who come
The
back
flip
and
side. Who supports the doctor?
doctors, married doctors. So I think
guess,
it's
yeah.
important. And at one point of time, I used to work at multiple different hospitals, but now I kind of share my time
Right.
between EY and Just Look Hospital. While yes, of course, I have a very good support system at home. My daughter, my husband, the people who help me out with taking care of my household, so that one thing is out of that. But it is our workplace, and
Absolutely.
we spend time in our doctor's lounge, have a cup of tea, let go of the day. Everybody is in the same boat. I think that is something that I have found.
I'm sure, because you do need an outlet at the end of
Yeah.
the day. One habit every woman must adopt.
You can't get breast cancer if you don't have any family history of breast cancer. It's a myth, yeah. 95% of breast cancers happen in women who don't have any family history of breast cancer. Self-breast examination. There's so many resources online.
One thing families get wrong.
Treating a patient like a patient.
One message to women ignoring symptoms.
Early diagnosis saves lives.
One word. What is healing?
Healing is different for everybody.
This was, personal. So it was lovely having you here, doctor. So one conversation, one check, one decision could change everything. Thank you, doctor.